BATwire implant kit for heart failure. Here's a quick summary about the trial. This trial is investigating whether the Barostim system, delivered by the BATwire implant kit, is safe and effective in subjects with heart failure. Subjects who are enrolled in the trial meet certain criteria set by the FDA, including having symptoms that remain despite treatment with guideline-directed medical therapy, and having a left ventricular ejection fraction of 35% or less. The trial excludes patients who are indicated for cardiac resynchronization therapy according to AHA/ACC/ESCAPE guidelines. Here's the timeline for this study. Screening will take approximately 3 weeks to see if you qualify. Timeline for the treatment varies by patient. After you enter the trial, you will be asked to share data with the trial for a period of time. Who is eligible to participate in the trial? To qualify, a few things must be true for you. You must have the following: you can walk between 150 and 400 meters in 6 minutes without assistance, as measured within the last 45 days before the start of the trial. Appropriate candidate for the surgery is determined by an evaluation from the implanting physician using a carotid duplex ultrasound, CDU, and/or a computed tomography angiography, CTA, and a review of medical history, including existence of infections that may increase implant risk. You need to meet certain medical requirements and have the right anatomy for the Barostim system implantation: a carotid bifurcation below the level of the mandible and no ulcerative carotid arterial plaques, and no carotid atherosclerosis producing a 30% or greater reduction in linear diameter in the internal carotid, and no carotid atherosclerosis producing a 30% or greater reduction in linear diameter in the distal common carotid, and have had no prior surgery, radiation, or endovascular stent placement in the carotid artery or the carotid sinus region, and able to discontinue the use of antiplatelet drugs, for example, aspirin, in advance of the procedure if required. Serum estimated glomerular filtration rate, EGFR greater than or equal to 25 milliliters per minute/1.73 square meters using the CKD-EPI method within 45 days prior to the Barostim implant. 60 days allowed if a proctor is required. Now, let's talk more about the treatment. There is a total of 1 treatment group, including 1 experimental group. There are no active control groups in this trial. There is no placebo for this trial. Patients who enter this trial have a 100% chance of receiving the study drug. There is one notable highlight for this trial. 1. No placebo-only group. All patients enrolled in this study will receive some form of active treatment. Where is the study being run? This trial is enrolling patients across 11 locations, including Scottsdale, Arizona, Orlando, Florida, Atlanta, Georgia. Discover more information about the trial and apply through our website at www.withpower.com.